As scary as it may seem, Parkinson's disease, which will be referred to by PD in this presentation, has been the subject of a huge amount of research in recent decades. In this presentation, we'll catch you up to date with everything we know about PD and everything we might know in the future. PD is a multifaceted progressive neurodegenerative disorder, which severely hinders an individual's ability of movement, leading to fatality. This occurs through the destruction of neurons and the accumulation of Lewy body proteins within surviving nephron cells. These specialized cells are responsible for receiving and transferring information and signals to target cells. These neurons produce dopamine in the basal ganglia located in the midbrain. This in turn affects not only an individual's ability of movement but also their thoughts, emotions and behavior patterns due to their loss of self-autonomy. The diversity of the disease offers different symptoms from person to person, with symptoms generally occurring once 70% of dopamine-producing neurons have reduced function. The symptoms of PD vary from resting tremor, muscle stiffness, stooped posture, rigidity, and difficulty walking and speaking within the later stages of Parkinson's. These symptoms may be attributed to the relative increase of the primary transmitter of nerve impulses, which occurs to compensate for the lack of neurons within the midbrain and cause muscle stiffness and involuntary movement, as well as the lack of dopamine, which regulates movement. The cause of PD is somewhat unknown, but rather resulted from a combination of an individual's genes and environmental factors. In cases of PD, it has been identified that particular mutations within the genome cause the onset of PD and may potentially be inherited from parents. Environmental factors have also seen to be potential risk factors to the early onset or progression of PD. Particular environmental factors including exposure to pesticides, toxins, and chemicals which may cause neuron death. Individuals' sex and age are known to affect their susceptibility to PD, as it is more prevalent in males and females, and mild symptoms of PD are known to occur during middle or late life, with full development occurring once individuals reach their 60s.
So how are clinicians able to accurately diagnose PD? The most widely used guidelines for diagnosis are set by the United Kingdom Parkinson's Disease Society Brain Bank, which provides clinicians with a series of recommendations for the diagnosis and treatment of PD patients. The primary steps involve the clinician's ability to identify the initial symptoms of Parkinsonism, which is the detection of bradykinesia, referring to slow movements, as well as either muscle rigidity, rest tremors, or balance issues. Once PD patients are diagnosed, how will they be treated? As PD is a complex disease, there is not a one-size-fits-all approach taken with the treatment. Clinicians tailor individualized treatment plans based on the stage of progression of PD and take into account the patient's lifestyle, age, symptoms, disabilities, side effects, finances, and other health issues. There are a number of different treatment methods spanning from medications, electronic devices, and physical activity, depending on the severity and prognosis of PD. The most widely used medication is levodopa. Levodopa is considered the most efficient medication, providing patients with stable alleviation of symptoms. Although levodopa is highly effective, its long-term usage causes motor complications such as dyskinesia, which are erratic and involuntary movements of the arm, legs, and face. It has been identified that 90% of patients experience some form of motor complications within 5 to 10 years of levodopa therapy. This significantly worsens their quality of life and clinically is the most challenging aspect of long-term PD management. Therefore, other treatments must be taken in supplement to levodopa. Studies have found that frequent, moderate to intense exercise reduces the risk of developing Parkinson's by 34% and could even alleviate symptoms in current patients. An 8-week study comprising 4 weeks of normal physical activity and 4 weeks of intensive physical rehabilitation found using a rating scale that there are significant improvement in motor skills such as posture, balance, and walking. However, during the 6 months follow-up of physical rehabilitations, patients did not regularly exercise and resultantly the rating scales returned to baseline.
So now you know all about how PD works and what we can do to treat it. Some of you may be disappointed to hear that there is not much we can do to stop the disease progressing. But this may not be the case for much longer. New research is coming out all the time and has found that caffeine, probiotics, and fish may all have protective effects for your neurons. We're also finding new ways to diagnose early stage PD, and that's through blood tests, brain scans, and even with experimental breath tests. Many scientists believe that gene therapy is the most promising path forwards. Gene therapy is the process of adding good genes to, or removing bad ones from relevant cells in the body. Clinical trials are underway right now, testing a gene therapy treatment designed to grow new neurons in the midbrain to replace the dying ones. If these trials yield positive results, we may be on the path towards a cure for Parkinson's, or even similar neurodegenerative diseases like dementia. Another promising therapy worth mentioning is deep brain stimulation, also known as DBS. Research into this field has been skyrocketing since 2000, and nowadays there are an estimated 12,000 new patients each year. DBS involves surgically implanting small electrodes into targeted areas of the brain. Activation of these electrodes can then offer the patient relief from tremors and rigidity. Think of it like a pacemaker for your brain, turning down all the unhelpful signals a PD patient's muscles are getting. This video displays the improvement that can be seen before and after DBS.
So how do you feel now compared to 2.5 years ago?
It's like night and day. It's a year ago I couldn't scratch the top of my head, and today I get up, I do all my ADLs and can walk and exercise. I'm back in the land of the living.
Fantastic.
At the moment, DBS's usefulness is limited to managing disease symptoms, but exciting new research suggests DBS may be able to stimulate neuron growth in its target area, a discovery that might one day see the treatment being used to slow or even halt PD progression. We hope that as you leave the presentation today, Parkinson's disease seems a little bit less mysterious. Treatment has seen some great progress in the past 20 years, and we can't wait to see what the future holds. Thank you.